When you are ready to give an injection, simply pull from the vials the recommended amount of allergen. In the event you have been supplied with 2 sets of vials, you will use both sets at the same time. In other words, you will give 0.1 milliliters of vial A on day 1 from set 1, and immediately give 0.1 milliliters of vial A from set 2 at a different injection site. It is important that these 2 injections are given at different parts of the body and not combined in one syringe at the same time. Continue with parallel injections from set 1 and set 2 until the schedule has been completed. It is also important to bring the extract up to room temperature before administering. Roll the syringe between your hands like this to speed up the process. Now let's go into more detail about how and where to give the allergy injection. As a reminder, make sure you give the injection at a time when you'll be able to observe your pet for 45 minutes to an hour. While reactions are very rare, they can occur, and if so, will usually be within 1 hour of giving the injection. Begin by preparing your injection with the proper dosage amount as directed by your injection schedule. Check the syringe to make sure there are no bubbles in it. If there are, flick the top of the syringe with your finger to remove them. If that doesn't work, push the syringe up a little, letting a small amount of the extract out, and if necessary, draw more extract back into the syringe from the original vials. Also, don't count the bubbles as part of the medicine measurement. Once all air bubbles have been removed, let sit for approximately 15 to 20 minutes, or until it reaches room temperature. If you have a small dog or cat, place it on your lap, the couch, or chair. Place your bigger dog somewhere comfortable, preferably lying down. It is important that you let your pet know you are calm and that this is not a stressful event. Make sure to have a treat ready after the injection for a job well done. With the hand that does not have a syringe, grab about 2 inches of scruff on the neck for a dog or between the shoulder blades for a cat. If your vet has another suggestion or location they like better, always follow their recommendations. Pick up the skin and make sort of a tent with it. At the base should be a ridge or well. This is where you should give the injection, as the injections are to be given subcutaneously, or just under the skin. Quickly inject the syringe with authority in the little ridge or well. Then rub your hand over that area, massaging it just a bit. From there, shower with praise and reward your pet with a well-deserved treat. Allergy relief is on its way. In the event that you delay or miss an injection, simply give it on the next available date. A day or 2 difference will not make a major difference, particularly once the injections are spread further apart in the schedule. While reactions are uncommon, the most reported reaction involves increased itching or redness. On very rare occasions, animals may develop symptoms such as hives, vomiting, diarrhea, or lethargy. In each of these cases, the amount of allergen injected is likely beyond the threshold, or tolerated dose, and your veterinarian will advise on a dosage adjustment. Please ensure that you note any adjustment to the dose in this diary for further reference. Remember that the goal of hyposensitization is to ascertain the highest possible dose that an animal can tolerate below its threshold. In about 80 to 85% of cases, animals can be injected as per the schedule provided without any adjustment. Having to make an adjustment is not a bad thing. It simply indicates that your pet has a lower threshold and therefore tolerates less allergen at a time. You can still, however, expect the same ultimate results from hyposensitization. Again, in the event that your animal exhibits any of these signs of reactions, contact your veterinarian with the following information: type of symptoms, the date of the last injection, dosage amount and color of vial, and how soon after the injection the increase in symptoms occurred.